my Hi everybody, good afternoon. My topic for today is postnatal mental health challenges and yoga for its management. So before I start into the topic, I want to first thank Dr. Nutan ma'am, especially because I mean this is the first time I am in person, live at least interacting with Dr. Nutan. Throughout the course, it's been like virtually. So Dr. Nutan, I really appreciate you putting up this course. Personally, for me, it has been really, really enriching. I am a yoga trainer, so this was to add on to my capabilities, but I think I got much, much more than that. So because I am not married, I do not have kids, but during the course, I felt like as if I am also pregnant. Like the way you delivered it gave me those feelings, those positive talking. So that really helped. So thank you so much. Dr. Sarita as well for all her knowledge on, anatomy and physiology. I have gone back to those sessions again and again. And yes, thank you to my mother and my nanny as well, especially during the assignments, the essay writing, and this presentation as well, because of this course, I think I have interacted with them more regarding this topic of pregnancy, my pregnancy, like how, it was for my mother, everything that she went through, what my nanny did for her, what all used to eat. Like when Dr. Nutan mentioned in the fourth month, those cravings happen. And my mom, she's eaten so many sweets. So no wonder I have a sweet tooth. So, I was able to relate that, itna pasand hai ye sab khana. So yes, thank you so much, ma'am, for putting together this course. I really, really appreciate, and it's been for me personally wonderful. So yeah, this is actually me when I was born, and that's my photo with my dad as well and with my nanny. The reason I've put together these photos is because I went back when I got this topic of postnatal mental health challenges. I mean, first question was to go and talk to mom. Kaisa raha, kya kiya, because, and I was her first child, right? And the first daughter, granddaughter in both the sides of the family. So she went through a lot. And I'm going to use those examples only for the presentation today because for the ones who are pregnant and shayad sikhane bhi wale hai, I think they might meet such clients only. So back then, this is at least 30 years old photo. And my mom, the mental health challenge that she went through was after she delivered, she was like, अब मैं कैसे संभालूंगी? Because first child, and वो ज़माने में obviously Garbhasanskar was not something that was taught. My father, I mean, not just my father, I've seen the men at that time, that kind of support was not there. That was missing. So my mom went through that kind of challenge of managing everything on her own, even during the prenatal period. Like, she's done all ghar ka kaam. No wonder, I mean, she had a normal delivery, but she was all alone in that way, right? When she was at my nanny's place, she was doing fine. So after the delivery, after the postnatal period, because of the stress, so that is one thing that I want you all to know, because of the stress, she lost 10 kgs directly in a month because of how will she manage the entire thing once she comes back to her in-laws place. So that brings us to the importance or discussion that why we should all be talking about mental health postnatal. Because as Ruta ji mentioned that everybody, it brings a lot of good emotions, जो pregnancy hoti hai, everybody is happy, a lot of good emotions are there. But somewhere कभी-कभी हम शायद realize नहीं कर पा रहे हैं what the mother is probably going through. शायद mother herself is also not able to understand because so many things are going level, emotional level, psychological level. So it's other mental health issues like depression, anxiety, any other the suicidal attempts, right? So it's very important for not just her partner, but for her family around her to also be aware. Okay, baby to naya, like we've got a new person in the family, but the mother is also a new person now. So it's important to pay attention, and hence it's important postnatal mental health. There are certain stressors and risk factors. So जैसे socio-demographic risk factors. So the age of the mother also matters because the maturity would be there. The income of the family, because if low income is there, that's another additional stress कैसे manage करना है. Personal or family history of mental health problems, that's definitely a known. कि genetic issues, hereditary issues can come up more during pregnancy. increased current life stresses. So now with most of the women being working women, so that is another stress that the woman may be going through. Okay, how will she manage after her maternity leave gets over? So very important for her to prepare it during the prenatal, during those 9 months only. It's important for her to get prepared to all of these. Then obstetric related factors like pregnancy intentions. Was it by choice? Was it by chance? That will also affect the nutritional status, previous birth outcomes. If she's had a history of abortions or miscarriages, that is also something that can affect her, right? When she has this new baby, lacking practical, social, or emotional support. Like the example I gave of my mother, where I mean, we were not lacking any kind of social or practical support, but more of that emotional support, which was not those things. वो time पे बात ही नहीं होती थी. How are you feeling? It was more like ठीक है, healthy wise, physical level पे everything is okay, fine, chalo good. You know, if you're feeling sad, I don't think a lot of people spoke about it. Current drug or alcohol problems, history of abuse, that is also something, and having an anxious or perfectionist personality. This can actually affect a lot of women I see, because these days सबको है कि मुझे सब कुछ perfect चाहिए, सब बराबर एकदम perfect, जैसा सोचा था वैसा होना चाहिए. Now in case something 19-20 भी हो जाए, that can also cause a lot of stress thinking, अब ये नहीं हुआ तो क्या. Anxiety then itself can lead to, then depression and all those things. So hence stressors से mediators आ जाते हैं. Mediators यानी कि already maybe there is some form of subtle stress that is growing in the mother's body. फिर अगर समझो वो टाइम पीरियड में, पोस्टनेटल केयर, सुतिका परिचर्या अगर अच्छे से नहीं हुआ है, if she is not taken care of properly, that will become a mediator or like a catalyst to create the other mental health challenges. अगर बहुत complications है जो हमने अभी पुराने presentations में देखा, that is also a mediator. So what will be the outcome is postnatal depression, suicidal attempts where the mother may not really feel like, staying alive. At times, they don't even get that attachment or emotions towards their own baby itself. So it's not their fault, but it's just the overall ecosystem that they were around with. She did not get that enough support. So hence, a woman needs a lot of counseling and mental health support to deal with her new role as a mother. And I personally feel it should start from day one itself, as in the day one of conception, so that mentally, because these things take time, धीरे धीरे होता है, she will prepare. So it's important. And how can yoga help in the overall management of mental health? Over here, I've not covered any aspects of practical this thing, because we're talking more about mental health at our physiological and the subtle aspects. So as I was also speaking on the other slides, mental preparation during the 9 months. So doing all the kind of meditative practices, dharana practices, concentration practices, jahan pe we allow the mother to sit with herself, to deal with her thoughts, and also to start putting positive affirmations in her during those 9 months, so that she's prepared for that big day that comes, and so that she's also prepared for all the upcoming, at least the first 45 days after delivery. Ishwa Pranidhan, this is something that we talk a lot about in Kriya Yoga, and I personally believe that it's very important in the postnatal period if you're dealing with stress, anxiety, is because when we have faith and we surrender to the higher energy, to the universal energy, it gives us a kind of strength or a confidence कि हम अकेले नहीं हैं. We are surrendering. हमने अपने side से we've done everything. So you teach the mother, or you try to affirm to the mother to surrender and to have faith in the higher universal energy that everything is going to happen in the right way. Mantra jap, om chanting, there are different mantras that the woman can chant depending on the faith that she has or the kind of God that she is strongly connected to. But if not, om being the universal sound can help anytime in any kind of situation, just because it helps us to bring more calmness, not outside us, but also within us. Sound healing, there are different sound options that are available, which can again make her feel calm. The whole idea is when the mother is going through that stress, anxiety, depression related, one, she needs someone to talk to, someone who's listening to her. One is that. Second is if she just wants to be with herself, all these different aspects can help her. Yog Nidra, me time and the personal space, diet, discipline, and lifestyle. So idea is to give her more rest. Kitni baar, because of that pain also, she gets all irritated, not able to figure out what to do next. So if allowing her to rest more, ensuring the conditions around her are good, that can help. Healthy food leads to healthy mind. All the postnatal food care that we've discussed or learned about in this course, that is also very important. And asanas after 3 to 4 weeks, depending on which delivery it was. Ashwasan counseling is also extremely, extremely important for management of postnatal mental health, because allowing allowing the new mother to express will actually, I feel, just help her to feel very, very good and maybe, take away all her stress. So yeah. Some of the mantras that I've mentioned, which personally, yeah, I mean, for me also it helps. I mean, सिर्फ रात को सोने के वक्त भी if I'm chanting like Hanuman Chalisa, it just gives me a lot of strength. Gayatri mantra is there, Mahamrityunjay mantra, Shiva mantra, or any other mantra. Matlab, I have just mentioned a few examples, but I solely believe that mantras are really, really powerful sounds and they can help. So yes, thank you so much.